Hey, Dr. Lindsey and Wendy here. This is a 7-year follow-up on one of our UK patients who just sent some pictures in with the okay to use his face. So this guy came over in 2012, needing like a medium-sized case. And
yeah, we did his.
We packed him in there with the hairline that's kind of my hairline. And although he's not my age, I think that'll age well over the years. And then he stayed for a week. Here he's at the end of the case. And on day 3, he decided he would sleep on his side. And so this is a pretty typical appearance if you sleep down or on one side. Looks like somebody popped him right in the eye. And it doesn't hurt. It's normal swelling if you don't sleep propped up. And that's typically gone at day 5. So all our traveling patients, I tell them either fly out tomorrow or wait about 5 days. But if you go on day 2 or 3, it look like a Klingon or something. And then he sent pictures in 4 months, thinking it was growing. I'm not sure it was really growing.
Some.
And then he sent pictures at 4 years, and this is with his wife's headband in, and one without his headband. And then he sent pictures 2 weeks ago while I was out skiing, and he looks good. With the comment that at 7 years he's still holding up well. And this is I think one with a headband and one outside in the sun, and he looks good.
Yeah, he looks really good.
Yeah. So just wanted to give you guys follow up on 7 years out from a medium-sized case on an international traveler. You know, if he lost more hair behind that, or any of you guys that get this done, it's certainly easy to do a second case without a lot of downtime because the front's already done and filled in. And so you can pull it off without a lot of
cover it, yeah.
So if we can help you, please give us a call. Thanks.